pretending the music is going, and the music is going. And 3, 2, 1. And welcome to the Anatomy of Therapy. I'm Dr. John Cybulski here with Bobby Riley in Iceland, who just moved this weekend, but we are with a very, very special guest, a very good friend of mine, old friend, Dr. Travis Owens. You may know him more officially as TheCheerDoc on Instagram. One of the very, I don't know how many doctors actually I don't even know would you say cheer doctor, cheer coach, doctor geared toward cheer athletes?
As far as I know, there's only 2 that are hard, fast, not specifically cheer, but our main focus is cheer, myself. And there's another doctor in Canada who has a clinic in a cheer gym as well. And he does, he's also doing like some research on strength conditioning with his athletes. I know of some former cheerleaders that are also doctors that may work with, recognize athletes and things like that. But as far as like directly focused on that particular population, I believe there's only 2 of us.
I think there's only one in my book, and it's you. Number 1 in my heart, at least. But no, leading the way in the cheer doctor field, my friend and soon to be yours, Dr. Travis Owens. Thank you for being with us today.
Thank you guys for having me.
No, I really have, I don't know, as a friend and a doctor, known you first and foremost as a doctor, but getting to know you, found out that you had a little bit of a background in cheer, being a cheer athlete, and in college, and I'm sure before that. But can you give us a quick little, where did you come from, man? Florida,
Sure,
no?
Yeah. Originally from Florida, born and raised in Panama City Beach. Cheer, I tell people cheer is like the longest running joke of my life. And on my deathbed, I'm going to be like, I got you. I got into it as a joke. I was a football player with the high school, and I saw a flyer at our school for a free tumbling class at a gymnastics gym that was right across the street. And so my first thought was, cool, I'm going to learn a backflip and impress girls. That's all I wanted. And so I showed up at this gymnastics gym, and I see a guy that I played football with. And so I said, "Oh, you're here for the backflip class too?" And he's like, "Yeah, actually, yeah." And I was like, "Awesome, dude. Awesome." So we go out on the floor, and he grabs a clipboard. And turns out he is coaching the class.
Oh.
And so lost. And like, what are you doing? And he's like, "Oh, dude, I've done gymnastics my whole life. I only played football because my parents wanted me to try something new." He's like, "And I hate it." And so I said, "So you're teaching me how to do the flips?" And he's like, "Yes, I'm teaching you the flips." So within a very short period of time, I learned, some basic tumbling. And, I had done other sports up to football. I loved new challenges and trying to master new things. And so when you learn how to do a back handspring in less than a week, it kind of, it hooks you. So signed up for classes, started taking tumbling classes, really started to engage in this whole new tumbling thing. And one day I joked with him and I said, "Man, it'd be hilarious as if we try out for the cheerleading team at the school." And I was like, they would laugh us out of the gym. And he's like, "I've been thinking about it. Like, I just didn't want to do it by myself." So like, "It's done. We're going to do it." So we go to the tryout. We walk in the gym, and in what I know now, which is every single team on the planet wants guys. We go in, we think we put on this hilarious performance. We're surprised they haven't kicked us out, and we both make varsity. And then we both freak out and don't know what we're going to do. And they're talking about camp and parent meetings and this and that. And we're both just looking at each other. We can't quit. We just made the team. So so our plan was, okay, we're going to ride this out. We're going to go to camp. We'll figure it out. Then we'll make a decision. And we show up at a camp in Alabama, and we get off the bus, and they corral us all into this Coliseum, and we're looking around, and there are 2,000 girls and 12 guys.
Sure. Good odds.
Camp. And we decided that cheerleading was for us.
Yep.
And so fast forward, go through the year, you're still learning, and we learned a lot at camp, and really like yes, it was kind of like unexpected, but, there was still that challenge. And so started learning new things, really got excited about it, started gaining skills quickly. And then from there, I tried out for the local state college at home, made that, started coaching All-Star, which is the competitive side of cheer. Started coaching there as well. So I was coaching and competing All-Star and also cheering for the college. And so I kind of just immersed myself into cheer as much as I could. Fast forward from there, made it to the University of Florida for undergrad, made that team also. Started traveling and doing camps around the country, teaching skills and things like that at different states, which was an amazing experience. From there, once I graduated undergrad, I coached a high school team for a bit before going to grad school. While I was at Life, I helped to start a complete all-star competitive program while I was in Atlanta. I worked with them for a few years, which is an amazing experience. And then from there, I thought I, kind of hung up my pom-poms. And so once I left Atlanta, I kind of let, cheer seemed to kind of fizzle out, and it was a distant memory, but it was always that, thought of, I love this. It was so much fun. It was a huge part of my life. And so I'd always find myself kind of like watching old, competition videos or watching the new athletes and seeing the stuff they're doing. And so at the suggestion of a friend, I started to create content for cheerleaders, understanding what they went through with my own injuries. And then having met cheer athletes in clinic and having, connecting with these kids and parents like, oh yeah, I used to do that a long time ago. And so from that has evolved into the content platform now, which is, as you mentioned, the TheCheerDoc, where I create content for athletes, that an underserved athletic population.
Awesome, man. So you breezed over it a little quickly, but like, what got you into grad school, into Life? Why did you want to become a doctor? I mean,
so as a kid, yeah. And it's funny, they're actually all, it's kind of interwoven there as well. I had always wanted to be a doctor even when I was little. I think it came from like watching my mom watch, what was that show? Was it ER?
Mm-hmm.
With
you
George Clooney?
George Clooney.
Yeah. And so I think watching her like, oh, George Clooney, these doctors, like think like, oh, that's what adults like, is doctors. So like, I need to be a doctor because then I'm contributing. So at University of Florida, I had some really bad chronic, now that you're kind of, we're in the know. I had really bad chronic patellar tendinosis, like through my entire collegiate career. It was like years and years of like 8, 9, 10 out of 10 daily knee pain, both sides. It was awful. And so I followed the entire medical model of, go see the PT, go see the AT, heat, stretch, all the stuff that doesn't work. And I met a chiro my senior year, and he had talked to me about my knee and my knees and stuff. And he was the first one to ever say like, hey, do you want to try something different? I was like, I'm down. I'll try anything at this point. And so he showed me some things that actually for the first time in like 6 years made a difference in like instantly.
That's awesome.
And so that moment like really was a big catalyst in going to chiropractic school. And it planted a big seed that when I graduated from undergrad, I was kind of in this limbo of what do I want to do? Do I want to go into healthcare? Do I want to go this route? What route? And so I reached out to a guy that I was very close with in the cheerleading world who was in chiropractic school at Life. And I said, hey man, tell me about this program you're in. I met this chiropractor, had this really great experience. And I think you guys went to the same school, and like, tell me about it. And he's like, why don't you just come up for a week and just come stay, check out the campus, like get out of Florida for a few days, come hang out in Atlanta. And so I took him up on it, and I drove up and fell in love. And it was so cool to sit in a neuroanatomy lecture and hear about spinothalamic tract and actually like understand like, oh, like that makes sense. Like what this guy's talking about. So yeah, I applied the next week and got accepted. So very cool. The rest is history.
There you go.
Well, what were the things that the chiropractor, showed you that was different than, he claimed that, let's have you try something different than you have been trying. What were those things? And then was that the impetus for I'm presuming here the route you took after graduating chiro school would be somewhat non-traditional for
Sure. Yeah,
chiropractor. You know, you're not
for
high
sure.
volume from my experience.
Yeah, absolutely. So the first thing he did was he made me start to think about what was going on in a different way. The traditional thing at Florida was, you have ATs. It's a D1 university. At the time, we had won the 06 national championship in football. We also won the basketball championship. Tim won the Heisman. We were on that season was our second national championship in 3 years for football. So everything was just very like high level. And if at Florida, we were considered half-leets. We had all the requirements of an athlete, but we didn't get all the benefits. So we were like last. And so our treatment was come in, hydrocolate your knees before practice, after practice, ice cup, during practice. Like I wore out. Like I should have bought stock in like the knee straps because I wore them out because I would cinch them so tight that like I needed a new pair every 2 weeks. And that was my protocol. And like 2,000 milligrams of naproxen a day. That was it. That was all I was told. Do that. It'll get better. And this guy was like, let me watch how you squat. Let me watch how you let me see your hip flexibility. Like, have you tried foam rolling? Have you tried, and he was somewhat traditional. So he checked my pelvis. He adjusted my pelvis in the locker room before I went out for a game and was like, let me adjust your pelvis. He went through some functional range stuff, did some rolling and stretching different. And I had one of the best games I ever had. And it was just, I had never met a chiropractor before. No idea what chiropractic was. I just knew that this guy did something that the AT and the MD on the team didn't do. And going into practice, I didn't start, the line of care that I do now with that's, as you mentioned, that type of model. I actually went with another company and ended up leaving that company because of philosophical differences of high volume. They wanted high volume. They wanted year-long care plans for everyone, nothing specialties. Basically like you threw your orthopedic diagnosis knowledge out the window the second you walked in their doors. And that to me just was, piss poor. So getting into this style of care now really is, kind of an homage to this doc who really changed my perception of how to fix pain. And got me back into what I would say is a more similar model to what he would have done if we weren't in a locker room at the SEC championship.
Wow, that's really cool. I think it reminded me of like what he did for you. Sometimes we just don't get that feedback from our own patients. Sometimes you have some of those patients that just give you a birthday card, bring you a present to say thank you for your care. But I would say 90% of them, just kind of, tacitly say, have their way of thanking you and never seeing you again. You know what I mean? And you have no idea of the sequelae of events that maybe occurred after you knew that person. Like how influential people can be, like that guy was for you. And I've moved a lot, around the US, and then even since graduating and living in the Netherlands and then Iceland. And when I moved, it was so surprising to me that people would give cards and give gifts and say, we'll miss you. And I can't believe you're leaving. And who's going to take care of me now? And it's like, before I said I was moving, I could have had no clue that these people cared at all. You know what I mean? So in other words, it just reminded me of, it gave me almost a little bit of chills in a good way of just hearing that somebody had such an awesome impact on you. And now you're doing the same thing for other people. And I just want to say, you're probably doing that for patients and clients and athletes, whether or not they tell you that or not, so just a comment.
Yeah, for sure. And to that point, I've had patients that come in that have seen other providers in our company, or maybe have seen other similar provider types from different organizations. And, the first thing I ask anyone that's been in is, who have you seen in the past? Like, who's your doc before? And the first time I had a patient look at me and go, I don't know. I can't remember a guy's name. It would be so easy to just look at that and be like, ha, but it scarred me. Like that moment, I made it my mission. I never want to have somebody I see answer another doctor the same way. I never want somebody to dismissively say, huh, I don't remember. Can't remember the guy. Like, if I'm not making a big enough impact for this person to go, I saw Travis Owens like 2 years ago, then I'm failing. And every time I ask that question, there's always like that. And I wait for them to say, oh yeah, I saw Dr. Blank. I'm like, oh, thank God they had a good experience somewhere. And like that person was memorable. Now it's my turn to try to do the same. But yeah, 100%, man. You never know, what impact you're having until somebody sends you a card to Iceland to thank you. So,
I mean, I would agree, knowing you for a while, that we will be at meetings at our company, and anytime someone will speak up and talk, sometimes you're like, Bobby's going to speak up and tell some random story. There's a guy at our company. Well, Dr. Askew, who was on a couple episodes ago, when he starts to talk, people go, okay, he's going to say something. Same kind of goes with Dr. Owens. Whenever he speaks up, he's not just going to be kind of flapping and just kind of saying nothing. I will say the same thing for your content on the TheCheerDoc, man. Like, there aren't really throwaway posts. I feel like so many of those posts have so much kind of content in them. Some people may pass over and not really see it, but I feel like some of it, just like your workout, your conditioning stuff, some of the stretching stuff, I know you've got so much going on in your head. You can just see that kind of come out in each one of those little posts. And I kind of want to dig into that a little bit. So on your page, you give out, a wealth of information for free. And there is an organization to your chaos, which I can appreciate.
I hope.
Yeah. So there's always a kind of a workout. There's usually some sort of kind of stretching and mobility, and then generally kind of a strength thing. Now, I know you've kind of switched up from time to time, but are those generally the 3 or 4 kind of different avenues you would say you would try to go with?
Yeah. So if you're on the Instagram page, which is kind of, we have our largest following, we tend to stick to 3 pieces of content over the last few years. And that is, there's a strength conditioning piece each week, and that is designed specifically designed to accommodate a cheer athlete most efficiently. There's usually some sort of Olympic weightlifting or kind of compound movement that would be similar to in the sport what's called stunting, which is where you're lifting someone overhead. So usually something more compound of that nature. And then the second piece is usually geared towards body weight movements, things that they can do in a cheer gym, because a lot of them do not have access to weights and things like that. Trying to pioneer an entirely new style of strength conditioning in a sport that historically, number one, has never had it put this way. And then number 2, doesn't even realize what they need. I really try to tailor the workouts to something they can do in their gym with little to no equipment. As the years have gone on, and I've kind of started to stray away from trying to cater to, what they have now instead of pushing them to evolve more. I've started to get more into things with more weights, things with a barbell perhaps, and really kind of trying to push them out of their comfort zone into more appropriate strength and conditioning avenues. So typically there's a strength conditioning piece each week. There is a kind of an anatomy, physiology piece that will involve, some sort of injury, some sort of common deficit that they may have that leads to injuries. The anatomy of a cheerleader is hyper specific to what they do and is also highly injurious under normal, what would be normal circumstances for most people. So try to do something to try to unscrew up their anatomy that's been laid down. And then we also I do a game film. So I have kids that submit things, say, hey, can you look at this and give me some pointers, And so what I started doing, this is kind of what helped to grow TheCheerDoc to the level that it is, was kids would send in a video and I would break it down kind of frame by frame and explain, okay, this is what your problem is here. This is what your problem is here. This is likely due to this being weak. This is being tight. This is off. You're not doing this right. And we kind of break it down and give them pointers, say, do these 3 things at your next practice and incorporate this into your routine. And then, after 30 days or so, reassess where you're at. And so giving those direct feedback and actually bringing the kids into the content and allowing them to, to see a new way to address their problem was really, really big. So those are our 3 big things on social media. As far as Instagram goes, and on YouTube, also do a podcast similar to you guys, where we'll do, trending topics in the sport, or have interviews with high level athletes or coaches, discuss things like the Cheer show that was on Netflix. We had an episode about my thoughts on that and how poorly that they showed the public that they managed injuries, even though I know that they did better, because I know some of the athletes from that school, and found that the way that they portrayed it wasn't great, but that they actually did have good care. So yeah, but for as far as we try to stick to those things and just make it uniform, so it's something that they can expect.
Well, I'm thinking of listeners who are not that familiar with cheer. I think in the States, they probably have a pretty good picture.
Mm-hmm.
And maybe you can clarify a little bit of the differences within cheer as well for
Sure.
the people that are kind of already familiar with it. In
Sure.
Iceland and in Europe, overall generalizing, I would say it's more, there's a lot of dance, there's a lot of gymnastics. Iceland, there's something called team gym that's very popular, but not something so much connected to as cheer. But any practitioners that are outside the States listening, I think the same things that you're going to probably touch on here can apply to whatever sport it is, especially if it's somewhat similar. Something like gymnastics and dance are going to be probably the most similar. I think you would agree, except for maybe this idea of overhead pressing maybe makes it slightly different. But to preface that a little bit, I also have a follow-up question, which would be, I have a little assumption or presumption that maybe some athletes get into cheer later in life compared to gymnasts or soccer players or football players, where I'm wondering if you see a connection to the people that are the kids that start cheer maybe in high school, because I want to play a sport now, but they weren't brought up doing cheer. So maybe they didn't develop the prerequisites to, have great overhead mobility and flexibility combined with strength, which is kind of something that's hard to earn, to be honest, especially if you didn't set the groundwork early. So hopefully that wasn't too much of a question for you.
Actually, your second question is probably the faster answer. On the male side of things, you typically see guys get into the sport later. And this is no knock on high-level male athletes. Most high-level collegiate and beyond male cheer athletes were standouts in their sport, but maybe weren't good enough to be a D1 linebacker. So they hand them a 95-pound girl and they say, well, throw her overhead and see what you can do. And it's nothing. So they catch on very quickly. The 2 top male athletes in the world right now, one was a Team USA Olympic weightlifter that was like 2 or 3 time national champion. He was a international champion, and he was on the junior Olympic USA team and fell into cheer after a back injury. But the guy can still snatch 330 and still clean and jerk 400. And you give him a 90-pound girl and she goes to orbit. Yeah. The other was a collegiate baseball player, 6'4", 260, 250, massive human being. And he was recently featured on Ellen for taking 2 girls, backflipping them both and catching them both on one hand each. So a lot of your big guys do get into cheer late, but what you're seeing now is this evolution where kids are actually getting into cheer more at an extremely young age, like 4, 5, 6 years old, and they're doing it all the way through their entire childhood, teenage, and into college years. It's not very often, but there is some beginnings of gymnastics type, like I'm at the gym all day, we have school at the gym, or we're homeschooled, and that's it. You're starting to see that in cheer as well. So you're having kids that are homeschooled, they're in the gym all day long, working on skills. For us, it's dance, jumps, tumbling, and choreography. And in gymnastics, you're working on, your 4 main skills. So you're starting to see a lot of similarities with that. As far as the, kind of abroad, yes, cheerleading outside of the US, Canada, And I would just say those. Outside of, those two, it's the Wild West. A lot of the countries that have cheer outside of, the United States, there are some that are further along. Australia is much further along than some places. Singapore and Taipei, all are much further along than other countries. But it's still like one gym maybe in the country, or two gyms maybe in the country. Now, even though it is that scarce, one thing I do want to point out to the docs that are listening overseas and thinking like, oh, well, I'm never going to see these athletes. There is an international cheerleading organization called the ICU, the International Cheerleading Union, that holds an annual international competition where dozens of countries are represented by a national cheer team. Austria has a team, China has a team, Japan has a team, Australia has a team, Jamaica has a team. I mean, there's all girl and co-ed in these teams. There's Central American teams, South America. So there are dozens of countries that have national cheer teams that compete at a high level. And some that are actually some that once have beaten US, which is where cheer started. They've actually lost one year to it. I believe it was Chinese Taipei, and 1 year almost lost to Chinese Taipei. And so it's very competitive, even though it is kind of scarce. The high level skills that you usually see from American athletes, you are seeing overseas because these countries recruit American coaches and choreographers to teach them. So they're not behind by any stretch as far as skill and danger of activity and high level risk and things like that. There's just not as much.
So what would be like the main crossover you would say between, so like for our European friends, the gymnasts, those guys, what would be the main kind of crossover skills or capacities you would say?
Sure.
Yeah.
Sure. So I think the best way to start to answer that is cheerleading right now is in the final phase of Olympic approval. Oh, so we'll be in the Olympics. As of now, we're supposed to be in the Olympics, not this one, but next one. There's a few things that need to work out as far as different countries and things like that. But for the most part, that's what we're anticipating. We already had approval. We had approval for funding and all that kind of stuff. The thing that makes cheer different, that was one of the first things I had to nail down, was how is this going to be scored differently than other events? Because if, with cheer, it's an amalgamation of tumbling, dance, jumps, choreography, like all this kind of pyramids where you're building on top of people. So if you break that down, tumbling is gymnastics, dance is rhythmic gymnastics, building in pyramids is acro. Basket tosses where you're throwing a girl, she's flipping and being recaught, that's tramp. So you have all of these pieces that you have combined into one routine. And if the scoring was not perfect, what's going to stop an Eastern European team from pulling their entire gymnastics team and just running, tumbling, and a little bit of dance, right? So the first thing they had to do is organize what is the percentage of each skill. How is that fair so that it doesn't overlap with another event or another sport? So to answer your question, a lot of your crossover is going to come from, if you live on a blue mat most of your life with springs underneath it, you're likely would be a good cheer athlete.
So can you touch on, I mean, you can tie back the Instagram post that John brought up, like the good kind of spread and, the mentality behind you, how you lay down posts, and tie that together with the kind of prerequisites or the skills that you need to be good at this sport or to stay injury free as far as that's possible. And tie that in with what you see most commonly. Like, what are I'm sure some of it is age dependent for certain types of injuries, and some is just the sport in general brings up a certain type of injury. And can you just get into those a little bit for us?
Sure. Yeah. So the general anatomy of a cheer athlete, when we look at it from, a clinical standpoint, what I see is you have an athlete that is hyper flexible in the posterior chain for jumps, for tumbling. Hamstrings, glutes are extremely flexible, but terribly weak. So you have, because the primary focus is you got to get splits. That's the number one. You got to get your splits. So they focus very little on posterior chain strength development and more flexibility. So you have hyper flexible in the posterior chain, extremely tight hip flexors, despite being able to do splits. You have a lot of anterior capsule laxity. You have a lot of pseudo hip capability that they cheat around because and this is no knock on our coaches. They don't understand anatomically what their goals are. They're just trying to get, can this kid get their pelvis to the floor with their legs, out to the side? You see a lot of, hyperextended low backs because there's not a lot of anterior core work done. So we find these kids unfortunately as young as like 5, 6, 7, locked in terminal lumbar extension just to find some facet lock to find stability. When they tumble and jump, so plantar flexion in cheer is deemed ugly, and you actually get marked down for it on choreography. So you'll find that most athletes are basically dorsiflexion is ugly. Plantar flexion is preferred. So you find these kids live in chronic plantar flexion during all activities and are chastised if they don't. So again, a lot of anterior ligament laxity in the front of the ankle. You see a lot of impingement because they're living in this plantar flex position, yet when they tumble, if they land short, they lack the requisite dorsiflexion to absorb. So you're getting a lot of anterior capsule jamming in the front of the ankle. The way I teach these kids is, how an inversion sprain typically happens is some sort of plantar flexion, some sort of inversion. When they're walking around their whole life in plantar flexion, they're 50% of the way to an ankle sprain all the time. So lots of ankle issues with, the number one injury, depending on what research you look at in cheer, is either going to be concussion or ankle. I tend to go towards what's most common is probably concussion. What's most reported and dealt with is ankle, but that's for an entirely different conversation. So weakness to the anterior core, shoulder strength overall is a huge deficit that a lot of athletes and not leading to pain or injury, just in conditioning, which is one of the main reasons why I started creating the conditioning content that I put out. Traditionally, cheer conditioning was a joke. It was last on the list at the end of practice. Let's do 20 minutes of push-ups, sit-ups, and running. And so you're taking athletes who their main, their whole goal is, can I do more push-ups? Can I do sit-ups? And can I run? Well, never in our sport are you here, ever. It's always here or by your side, or you're holding someone. You're never here. And so basically we're training these athletes to rely on pec and anterior delt strength when there's nothing in the sport for that. So when they're learning skills that require them to be inverted, locked out next to their head, they're going to revert back to where they're strongest and most comfortable, which is here. And so we see kids that struggle with skills and coaches that don't understand why they're not progressing is because, the only foundation we've laid for them is anatomically a 180 from what we're asking them to do. So, in one side linked to the injuries, the most common injuries that I treat with athletes are ankle sprains, inversion sprains. As bad as it sounds, like facet syndromes, pars fractures, pars issues in children because they are so hyper extensive in the low back. And then things like wrists that you're going to find anytime an athlete is on their hands as much as our athletes are. Shoulders are very rare. Neck injuries, very rare. Hips, very rare unless they strain an adductor going through, jumps if they're over jumping. But lots of ankles, lots of low backs, and lots of wrists. So trying to prep that, undo that pattern, and then treating those injuries specifically is kind of where the idea of the rehab and the strength conditioning comes into play.
Do you find it necessarily, I know you don't, I just want to hear how you go about it, because in terms of, like, let's say low back, they've got some low back pain, they're overextended in the low back. And I know from, fixing a lot of backs has to do with getting the hips right. And with athletes who have such a high level capability in their hips, I don't have a problem in my hips. My hips are fine. I don't feel any problems in my hips. and for the long-term success perhaps of keeping their back healthy, how is it you communicate that to those kids that, or what are you doing to their hips, or am I wrong? Maybe I could be wrong here, but how is it that you communicate that, or do you even?
So the majority of, trying to get compliance and understanding with what they have going on is sometimes it's just bypassing the kid. I mean, this is an expensive sport. It's expensive in money. It's expensive in time. It's expensive in effort. And when a kid gets hurt, there is no downtime for cheer, realistically, or that's the argument they make. So a lot of times I'll bypass the kid and just tell the parent, if you want your investment to be worth it, you're going to have to pull your kid from what I tell you to and have them do this rehab. If they want to get into the minutia of why, we can. But when I have a 9-year-old that has facet syndrome and I tell their mom, if you don't fix this now, she's going to fracture her back and she won't cheer anymore, I can say that in front of the kid and the mom. And so you can protect your investment with 2 weeks of pulling out and let's see how this thing responds. And then we'll build a plan from there. Or you can keep going and piss the rest of the season away. So I don't sugarcoat it with these kids because I've been in this sport for 17 years. I have been in and out I've been on both sides of the mat, and like, you have to just this is it. Like, you're going to do this or it's going to get better or you don't. And I don't want to hear you complain about it. The problem is I do that in a very tactful and loving way, but because coaches do that, which is a problem, it has generated a culture of fear with expressing, when they're injured. And so the kids will literally take my backspin. I have kids come in, we end up with imaging and they've got a stress fracture. Like, I know for a fact that did not start hurting yesterday. How long has your back been hurting? Right. A couple months. Why didn't you tell anybody? I was scared they were going to pull me off the mat. And so now I got a 6-month stress fracture in a kid who is going to be pulled off for a long time. And so, I think I went off on a tangent, but getting back to your question, I don't sugarcoat it with the kids. Like, I don't go into minutia with them unless they're a little bit older and they can understand. A lot of times it's just like mom and dad are sitting right there and it's your kid's back hurts because they have terrible range of motion and strength here. Their hips are whatever they are, if that even is a part of it. This is what we need to do to fix it. Is everybody on board? Cool. And kind of go from there.
There you go.
With some of those deficits that you described based on the patterns that develop over time with these kids, John and I have talked in the past, or actually it was last week, where we discussed one of my patients who is very fit, but just having her lay in a dead bug starting position was shaking violently. She's completely strong but just in certain ways. Mm-hmm. And that's not one of them, being able to maybe hold a posterior tilt or inverted, IR'd rib cage and be able to sit there. And I'm wondering, when you're describing these scenarios, I'm thinking, tibialis anteriors that are not really helping out, and things like hip flexors, you said, should be weak in the scenario. Or you said overused, right? So if you have, I'm wondering if you're doing things like a V, forgive me if my vernacular is not on point, but like a V sit lift off, things like that. I mean, are they overused to the point that they're strong? Are they overused to the point that they're weak? Have you found certain exercises that really help knock some of these things out?
Yeah. So it's an odd thing when you can watch somebody get into a full, right or left split where one leg is completely in front of the other, and yet they still fail a Thomas test. So they have extreme laxity, kind of joint capsule, where they're able to kind of wiggle their way around with some sort of lumbar torsion and some sort of, rocked positioning in the pelvis. And because a coach won't, that's uneducated in proper anatomy and mechanics, you can look at that and go, okay, well, their legs are flat, they're in a split. And so I'll have kids that come in and they're, I've seen them in the gym be able to do those skills, and then they fail a Thomas test and it hurts their back. So as far as like rehabbing and stuff goes, I try to get the biggest bang out of, like, for the smallest amount of effort out of the kid, because if I can make it simple for them and translate it, I'm going to get a lot more compliance. So I typically will start, like, if they're having low back issues and I can just see when they come in. I mean, they're just at rest. They look like J-Lo, right? They're standing there like super extended back. And we just try to find neutral. Like, can we find pelvic neutral? And if I can find that, then I tie that in. We start with that. And it can be as simple as them just laying on the ground and can you smash my hand with your back, right? And just learning this tilting position. And then from there, I quickly like to get into prone activities as fast as I can. And the reason for that is when we're looking at tumbling, tumbling is not really like lumbar flexion, lumbar extension. It's more hip flexion, hip extension. It's more that convex, concave, not a lot of this, right? And so if I can get them prone into a therapeutic plank, on their knees, aggressively tucking on the pelvis, and they can find that, then from there, I mean, that's essentially that concave position. They're working on the floor, which is something that they're, the apparatus that they're going to be most familiar with. And it's easy to translate that into some of their body positions that I eventually want to get them to, like inverted positions that we'll do even in office. We'll get them into a handstand in that concave position, and we'll have them start to work. Can they lock and unlock? So I typically will jump straight into sagittal plane as aggressively as I can, just to get them to find some sense of lumbar neutral and pelvic neutral. From there, we really have no rotational stuff in our sport aside from twisting, tumbling skills and dance. So I tend to wait to work transverse plane stuff until I know that they can own sagittal, because if not, like, there's no point. They're just going to hyperextend themselves into a back injury anyway. So I tend to focus a lot on that, and I really push them. I push them to try to get response as quickly as possible, and then show them, like, yes, you are successful here. We need to continue to go, and then try to bring it into their activity as fast as possible, because there is no break in the sport. So like 2 weeks out, that's a long time in cheer. So you're really trying to like keep them on the mat while you're rehabbing, which is why I push them to speak up early when they're hurting, so we can make small tweaks and a lot of times fix it. I'm sorry if that went off the cuff. Did that answer your question?
Yeah, and I would
sorry,
probably, man. No, you're doing good. I think you would agree with this, that I'm thinking here that these athletes, while they're also increasing their chances for injury due to these patterns and these positions, they're also decreasing their strength and their potential strength or performance as well. Because if you take these extreme, lumbar extension, plantar flexed, tight hip flexors kind of positions, or pecs, or whatever, is going on, I can see in an inverted position maybe very poor endurance and stability sometimes, because they're using kind of a one-sided, or only part of the mechanoreception that they should have, their proprioception. And then in something like pressing, without an ability to oppose a press through some kind of great core control, they're also not going to be very powerful either. And if you are just so strong, well, yeah, then they're going to press themselves straight into a stress reaction or stress fracture.
Absolutely. I love that you brought that up, because, when the kids reach out and they're, it's, the unfortunate part is our sport pushes progression extremely fast, which is another reason why I try to match their rehab and their return, is because it's not about with gymnastics. It's like everything needs to be perfect. With cheer, yes, we want to be good, but if you can get a kid better faster and get them on a higher level team, everybody wins, right? And that's not all gyms, that's not all programs, but most would agree that if a kid came in year 3, they're on a level 6, everybody's like, oh, hallelujah, this kid's amazing, versus like, well, their tumbling's kind of janky, they got really bad movement patterns. And it's because we're not judged so aggressively on perfection of skill. It's more, how does the team look all together kind of thing. And so what I tell these kids is, like, they come in, they're like, what's the trick for this? Like, how do I get this faster? How do I do this? How do I do that? And like, I tell them, like, there is no trick. Like, your trick is mastering where you're weak. And so one thing I tell every kid that comes, how do I get my back handspring faster? Like, I'm so close, I'm struggling. Spend 3 minutes in a handstand every day. That's it. Kick up against a wall, have somebody hold you. If you can do it on out in the open, but like every time you walk in that gym, if you're there more than, twice a day, if you're not, you're doing it at home, you're on your hands for an accumulated 3 minutes a day. You're building proprioception. You're getting comfortable being inverted. You're learning to breathe upside down. You're learning core control. For sure, shoulder strength. You're eliminating pec dominance. Like, it's just easy. And I have kids that I'm like 30, I was like 3 minutes a day for a month. And then after 30 days, message me back and let me know how your handspring's going. And every one of them is like, it's so much better. It's so different. Like, yeah. How many drills did you do for a handspring? None. You know? So it's a lot of times like we have these foundational skills that we start kids on, but once they get like to a certain point, it's like, okay, foundation isn't really as important now because now we're building. Like, it's almost like some coaches forget that foundation means foundation, like forever, you know?
Yeah.
And so once they reach a certain point, it's like, okay, now pour gas on the fire. Now let's get as good as you can, as fast as you can. And that's a recipe for disaster.
Right. And John, you can check me on this one, right? Because I think it was Tony Robbins that said most people overestimate what they can do in a day, and they underestimate what they can do in a year. And I always say, like, why does Matt Frazier win the CrossFit Games? Why did Rich Froning win the CrossFit Games? And why do they continue to win the CrossFit Games? Well, it's because they were able to train day in and day out for years without major injury. And the only way you do that is if you have movement competency and you move well and you have the prerequisites and you're not missing some fundamental piece of athleticism where you break down. Otherwise, you start over again, and those guys don't win the CrossFit Games. So just, yeah, John looked like he was going to say something very similar there.
No, I agree with you. And the thing is, like, Frazier, for instance, sucked at sprinting, right? Awful. Like, was it 16 games, 17 games? Sucked at sprinting, got like terrible. Came back the next year and won the event. So, like, not only is he like running foundational movement, right? Realized how bad he was at it. And instead of going, well, I did first and everything else, I don't need, like, he got better at that. And then you see how that probably translated to everything else he did now that he could sprint better. So the problem with cheer is these kids, like, we'll point out, like, you got this and this and this is bad. And they go like, oh yeah. Anyway, and they go like right back to what they were doing. Like, there's no, like, it doesn't make sense. And so honestly, like, that's the hardest part about like what I'm trying to do. I know for a fact, like, I'm, you know, being one of the first people to pioneer this thought process in this sport and try to create this paradigm shift, like, I'm going to die with minimal progress, which I'm okay with. I just hope to leave behind enough crumbs and hopefully, as you said, inspire somebody else that wants to, like, I want to do the same thing and, like, continue this thought process. Cause I mean, it's one of the fastest continually. It actually, as of last year, it was the only youth sport that showed growth. They did research on it. Every sport was on a 1 or 2% decline, and we were on like a 3% growth. And so it's continually growing, and there's going to be, you know, every year there's more kids and more athletes. And then when the Olympics comes, it's going to be worldwide, bigger than it is now. And so I just want to try to create this shift where people look at our athletes as athletes, and they, in order to look at them like athletes, they need to recognize in themselves that they have these unique needs, because your management strategy is different. I can't treat a cheer athlete under the same premise that I would treat a soccer athlete. You know, our competition is 2.5 minutes long. Like, you walk on the floor, you compete for 2.5 minutes and you're done. That's it. So you come to me with a grade 1 ankle sprain or grade 2 ankle sprain as a soccer player, say grade 2 inversion sprain. You're like, I got a game this Friday. I'm like, enjoy the bench. Like, you come to me as a cheer athlete with a grade 2 ankle sprain, you're going to compete that weekend. Like, because being where I was and where I am now, like, I understand how to get you to a point where I trust 2.5 minutes on that floor. And if not, that's why I have malpractice, but I'm willing to risk it. So what I hope is to, like, inspire other doctors to want to understand the unique management strategy of a cheer athlete and be willing to say, like, okay, like, I want to learn this and I want to help these athletes because they're poorly underserved.
So let's just say that in terms of other doctors, I mean, I don't have 17 years of treating cheer athletes. I'm learning. I've actually been to a seminar or two where Travis has presented some stuff on shoulders, I believe it was, maybe for cheer athletes. And I was like, okay, it's a different perspective on shoulders and treating them and return to play or return to practice, because this is very different. But let's just say, you know, for people that don't commonly treat cheer athletes, like, let's just keep it simple. What are like the top 2, top 3 things we need to kind of keep in mind? Kind of when, I mean, obviously there's a lot, man. And if the
for sure.
doctors have been paying attention, but like, what are the 2 or 3 things you wish that, other doctors would know if one of those cheer athletes does come into their office?
Sure. I think the first thing is to recognize the differences in cheer, like what cheer is. Most people, when they think of cheer, they think of cheerleading. They think of a skirt and pom-poms on a sideline doing splits. That is still part of cheer. That's still part of cheerleading, that sideline style. But then there's also competitive all-star cheer, or I should say competitive cheer, because you can have schools that compete. But then you have all-star gyms that also compete. So there's different styles of cheerleading. And the injuries will be somewhat similar, but your volume a lot of times of training and activity is higher on the competition side. So first thing I would say is just understand when somebody, if you have a cheer athlete that comes in, is to understand, are they a sideline team and that's it? So they're maybe practicing once or twice a week. They have a football game or a basketball game maybe once a week, and they may compete at one of the high school or national high school competitions. Or are they an all-star competitive athlete that is in the gym 4 to 6 times a week for multiple hours at a time, working on extremely high, rapid, more fast-paced, more volume, because that'll help to give you an idea of management strategy. Are we going to have to say, okay, like just sit this week out and then let's ease you back into tumbling, and that shouldn't be a big deal? Or if we pull you for a week, that's potentially 10 to 12 hours of training that this athlete's going to miss, and there's going to be a whole lot more fallout. So I think understanding the styles is very big. Just to understand volume, I think, is the biggest piece. You understand kind of what, are we talking like a hobbyist or like a professional, essentially?
So like how much like load or capacity their body is basically taking on a day-to-day basis. Like we've talked about habits in terms of like just treating general patients. Like if you're sitting at a desk, how much force is really going into your neck? You're breaking down pretty quickly, but you're saying these all-star or competitive cheer athletes are doing quite a bit more. Is that fair?
You usually saying, yeah. At
Okay.
least, up through, I would say up until the collegiate level, where you can be a school cheerleader and also have a highly competitive athletic career, because there are scholarshiped athletes at the collegiate level. So just like you have a football team that has, events that they go and do, and they try to go for a national championship, and they're student athletes and they compete, cheers the same way. They're practicing, they're going to their school full time, and they're also practicing for their own competition. So they're rooting for these guys and also preparing to do their own thing. So your volume there gets very high too. So I think number one thing, I guess, would ask the athlete about volume. I think that'd be the easiest way. Instead of trying to like figure out like, are you all-star, are you this, or that? Don't confuse yourself. Just ask them about volume, and you'll catch on very quickly as to what they're doing.
I know you work kind of closely with teams and coaches, but I mean, I can see from the work I do with a lot of gymnasts over here, I can see the initial pushback would be the coaches and the training routine, the volume that you're talking about. Mm-hmm. So how do you go about dealing with that issue where I know sometimes, I mean, I've said this with John, like my job for this particular gymnast is not to fix them or take their problem away. It's literally just to help them survive the year. Like that's it. But I mean, and sometimes, where do you draw the line and how do you deal with the coaches? Cause I can see the pushback is, is that exact problem of they work so, especially if it's a highly competitive team like you're discussing. I mean, if they're anything like high level gymnastics, I'm sure it's pretty much on the same level of 3-4 hours a day, 6 days a week.
Yep.
I mean, like you said, they lose 12 hours if they sit out a week.
Sure.
I just, how do you deal with that issue when you have to either really push somebody to stop, or do you have to, is it tough to walk that line?
I would say no, it's not tough to walk the line. And again, it's just because of my background. Like if I were to go to another sport, maybe like it'd be a little bit more touchy. The first thing I would say to anybody that, and this is, with cheer or anything else, like your first thing that you have to understand is they don't have to listen to you at all, regardless of how much you know, how proven your methods are. They don't have to do a damn thing you say. And I tell myself that every single time I see a cheer athlete. I can make every recommendation I want. back it up with evidence, show it, document it, boom. And then they could look at it and go, okay, cool. And they'll still go and compete. So you have to let your ego go of like, your recommendations are going to fall on deaf ears, and that's okay. You've done your piece, let it go. As far as the athletes you do have success managing, you have to create a relationship with the coaches to show your understanding of like what these kids go through. So that way, when you do make a recommendation, it doesn't fall on deaf ears because they don't think you know what they do. So invest, if you truly want to work with these athletes, invest in learning about what they do and also creating good rapport with the coaches. Because if you show that your whole MO is to keep them on the floor, then they're going to listen to you a whole lot more, because this team is not one kid. It's not one kid, gymnast that like, oh, I can't, like, darn, we'll pull another girl to do floor. Like, this is a team with 24 or 12 to 30 something athletes. And if you pull one kid, the entire routine has to be reworked. So they want every kid all the time.
Yeah, I really like that last bit. I think it's really important because I feel like, there's doctors out there, and I mean medical doctors, who are just, okay, it hurts in your foot. You got to take 6 weeks off. And no coach is going to listen to that, take that doctor seriously. Right. But so you could be the very strict doc. You could be the opposite. You could say, I can fix everybody, or at least nobody on my team is sitting out. Right. Until you lose people to broken, pars and then pars. And then now they have to get somebody else because you got parents pissed off and teams that are losing. So like what you just said is like the key, which is your experience. Just like they need time under tension in the gym, the clinician or somebody like you who's so passionate on the topic, you have time under tension. And it's that nuance that really matters. So it's like, you can't just become the TheCheerDoc just because you start posting on Instagram. And you can put up some good content and people might like it. But what I'm picking up from you that I like is this nuance, these details really, really matter. And so when you tell the coach, hey, this one, you have to respect this injury. This one, she's got to sit out. He's got to sit out, and they take you very seriously because you're not just, pampering every single person where, their stated pain is a 7 out of 10 today. So I think they should rest, you know what I mean? They're not going to take you seriously, but yet they can tell immediately that based on probably injury incidents and, how often you're right on these things, you build that rapport over time. And I just think that's exactly what you're doing. And to copy or to try to get something from what you do for whether they want to get into cheer or gymnastics or football or water polo, it is time under tension for you, the clinician, just as much the athlete.
Absolutely.
Yeah.
Absolutely. Yeah. And because of that, I rarely get, and the coaches and the parents, like they know from the get-go, my goal is to not pull your kid from the floor. And I tell them that. I go to the parent meetings, which are coming up soon for our program. I sit down with every single parent. I say, this is my background. This is who I am. This is what I do. And my goal is to keep your kid on the floor. If they will tell us that they're hurting, we can address it quickly and keep them on the floor faster. If they wait and it gets worse, then my ability to do that gets smaller and smaller. And so as you talk about this time under tension, if there is a sport that somebody's, looking at working with more, you don't have to spend 17 years to understand, enough of the details of cheer to be able to provide that. If I were to send somebody I had no idea about cheer and they, they're like, oh, what'd you do? Like, oh, I rolled my ankle. Okay, how'd you do it? Well, in the middle of my routine, and I was doing this and this and blah. And it's just like these docs are like, what are they talking about? It sounds like you're all over the place. You're running, you're jumping, you're doing this, and you are. So if I were to say, well, yeah, you have an ankle sprain, like, of course, my go-to is like, I don't know enough about this. It sounds like they're all over the place. Like, you need to slow down. Don't do anything. But I, having done it, know kids got an ankle sprain. Can they jump? Probably not. Can they tumble? Probably not. Can they mark their dance and still be in choreography so the team can continue to do their run-throughs and have a body there to make sure? Yes, they absolutely can. Can they stunt if their ankle is supported and they're just standing versus jumping and running? Let's try it out. Let's see. Can you do this level stunt? Yes, that does not hurt. Perfect. You're going to do that today. Now you're still a contributing member of this team. And then now you don't have to have the conversation of, Are they going to come back? Are they going to be there? Are they going to be there? I can say they have a grade 2 ankle sprain. It needs some stability. We're working on it. We're rehabbing. Don't pull them from tumbling, pull them from jumps, let them mark dance, let them hold their position during pyramid. And then when run throughs, let them walk through. Okay. There's no kickback. There's no, unless the only time you ever have an issue is if they're when are they going to be ready to go fully? And if we have a competition in 3 days, no, this kid's not going to be ready in 3 days. So then it makes sense to say, okay, let's pull you here, try to find a substitution or modify. Let's give you a week or so. Let's see how you respond with aggressive rehab strengthening over the next 7 to 10 days. And let's reassess. And so we try to give them that try to get the coaches to recognize my goal is not to pull your athlete. My goal is to do everything I can to keep them out there without making this thing worse.
It just seems like you've just got this kind of fog of war idea that we may have mentioned before, the ability to almost Google Map zoom in deeply and look at, the ATFL on an ankle sprain, but then back up, see the relationship between, say, the mother and the patient, see the relationship between the patient's family and the coaches, see the relationship between the coaches and the competition, see the relationship between the whole team, and be able to kind of back up and even dissect some of those larger principles, the different pieces of what goes into their play, but then at the same time be able to go down and be look, the front of your ankle is pinching, and then be able to back up and give them a little wider perspective on some of the smaller stuff where you get stuck in the fog of war and you're my ankle hurts, everything's done. I'm not going to be able to do anything. And you go, yes, these pieces are here. This is how it fits into the wider scheme. And I think, the lesson here for other docs paying attention is don't get caught up on the clinical nuances, perhaps, of your athlete's injury, but be able to see how that fits into the larger thing. Because really, that's what those cheer athletes care about. They want to be able to stay on the floor, right? And I think a lot of times if doctors just get too caught up in trying to fix their ankle, which is very important, and I know Travis can do very well and can break that down clinically just as good as anybody I know, still knows how that fits into the larger scheme of things and connecting with people on that level. And so on that level, I don't want to take up too much of your time. I know you're wearing a really cool little hoodie there as well today. I've never seen you wear that. Travis wears all sorts of wonderful clothes, but I haven't seen this one yet. So where does Hit Zero Nutrition kind of fit into this larger kind of cheer community? What gap is that kind of filling, would you say?
So when I sat down and really went through what was my goals to create and give back to this sport, I wanted to provide the things that they didn't have access to, or things that, maybe there were questions that there weren't answers to. If you ask any football player, basketball player, baseball player outside of your sport, what do you do to be better? And we could go through a whole list of things we've talked about, today: strength conditioning, some bigger programs you've got, or, organizations, you've got sports psychologists that are on that are keeping their minds right. They've got team dietitians and nutritionists and all this kind of stuff. So, I looked back and I said, well, outside of cheerleading, what do we have? Nothing. You may get lucky if a kid stretches at home outside of the gym, but they're in the gym, and when they walk out the door, that's it. There's no specific strength conditioning that's geared towards building their abilities outside of just doing the abilities. There's no resources for what proper diet, diets and nutrition that they should be fueling themselves with. These are athletes that in a day can burn through, 4,000 calories, 5,000 calories. They have no idea about nutrition and macronutrients, micronutrients, things like that. Mental problems galore. Kids are pushed too hard, mental blocks, anxiety. And I don't claim to be a psychotherapist, or, I can just offer suggestions from experience. But I wanted to create this environment where athletes could step in and go, oh, okay. That's really cool. Answer how to get stronger. Answer what should I eat? Answer how should I think? Who should I turn to? Et cetera, et cetera. And so when I started TheCheerDoc, it was to really address the strength conditioning piece and the injury piece, injury prevention, injury rehab, things like that. As I started to evolve that, I wanted to address the nutrition piece and the food aspect of it. Our sport is riddled with body image issues because even to this day, there are programs that weigh their girls on a weekly basis. These girls wear a lot of times very tight-fitting clothing. It's not to be sexualized. It's just like you wear a gi in martial arts. It has a purpose. Our uniforms have a purpose. You are holding people in the air. They have to have clothing that is tightly fit so that you don't slip on a skirt as you're, or on a, slip on loose pants as you're trying to throw somebody in the air. So we have these body image issues. The kids, most kids and athletes don't understand what they should properly eat and how much, and et cetera, et cetera, et cetera. And so when I started to create content for the nutrition side of it and just trying to educate on the basics of nutrition, I kept getting this question, and one of the biggest things that I would say, kids are really bad, not malnourished, but they're very low in protein intake. It's not helping their recovery. Like they're poorly nourished based on what they need to be eating for the level of activity they're doing. And so parents would just, okay, what do we do now? Okay, well, let's do this. Let's do that. What do we do? What's the easiest thing to do? How can I get this easy? So instead of saying like, go to GNC, go buy like a protein powder and make her drink a fruit smoothie after practice, I wanted to have something that I could say, okay, here, like take this, put it in a smoothie with some fruit and just make her drink that. And if that's our first step to start, like perfect. She'll get 25 more grams of protein, make a whole difference, right off the bat. And so I started I found a company to white label 2 products, a protein and, I hate the term pre-workout because I feel like it sounds really douchey, but the goal of it, I wanted to create something that the kids could use instead of Monsters and Red Bulls. Cause I swear to God, it's like, there's dozens of them a day I see in the gym. So like, can we create something that'll give them energy that's better for them, has more nutrients in it than just 350 milligrams of caffeine? And so I created a formula that had, that was the goal for that. And so I launched these 2 products. I had them white labeled. I created a basic website. And it was really just if I had somebody ask, I could just say, here, take this. Like it was supposed to be a very niche, very tight, just one-on-one type thing. Without going like crazy deep off the deep end, it's become more than just a one-on-one type thing. It started to get some popularity in the cheer community and out. I had CrossFit gyms that I was very close with that actually asked to retail it as well. They really enjoyed the products. And so we've expanded to now 8 products with another probably 8 to 10 on the way to become like a full spectrum line for really anyone. And I guess the reason I'm wearing this today is the relaunch of the company with this expanded line happened yesterday. So very, very big weekend. Lots of sleepless nights and stress and tears of fear and tears of joy. And so Hit Zero Nutrition is the kind of wellness nutraceutical line I started for with cheerleaders in mind. And the term Hit Zero in our sport is based on scoring. So when you go to a competition and you compete, you have all of your skills that you can do in your routine. And those total possible skills, if you're perfect, give you a raw score. Then you go compete that routine and the judges watch you and they deduct from you mistakes that you make. So if you touch down on the floor when you're not supposed to, that's a mistake. If you drop somebody, that's a mistake, et cetera, et cetera. And so you get a raw score and then you get your actual score. And if your raw score and your actual score match, that's called hitting zero, as in you hit 0 mistakes, 0 deductions, you did perfect. And so I really took that ideology of hitting zero and created the brand. And that's become like the foundation of everything that I do. So 4 or 5 of my ebooks are all called Hit Zero. In some stretch, the company is Hit Zero Nutrition. And our tagline is zero deductions, 0 mistakes, hit zero. And
That's
so,
awesome.
so that's the new venture that I'm really hoping to kind of fill that last void that I can fill. Again, not being a psychologist, I'm not going to get into the mental blocks part.
Dude, I've seen some
But
of those YouTube videos, those mental block ones. They're pretty, I mean, they're solid. You're not, I know you're no Freud or anything like that, but I mean, I think there are some pretty solid tips through there. I can tell personally as someone who's just got mental flaws out the wazoo. I always appreciate any tip I can get. But yeah,
well,
if
thanks,
you
man.
haven't checked out Travis's YouTube page as well, that's for sure fantastic. He has so much free information out there. That, I mean, if you're in the cheer community, it would be a real mistake not to at least check some of that stuff out. There's a wealth of, you've been putting up content for a long time, and I know you pour your heart and soul into kind of everything. And I really appreciate you having us on today. Any last comments, Bobby, before we go?
I have one closing question. One closing question, but congratulations on the line and
Thanks, man.
all the success you've had so far. And I think we could close with this question, which would be, I'm sure there's going to be, you know, the enviable listener here who was, you know, listening to everything throughout this whole episode, who is kind of, maybe, like I say, enviable listener because they kind of admire the situation that you've earned your way into. Any recommendations for those type of listeners who say they do want to be a big part of their community, they do want to be that guy for their football team or American football team or cricket team or whatever it is? It doesn't have to be cheer or gymnastics or boxing, I don't care, but just the fact that you know have earn the right to, you know, take care of those athletes and earn the trust of those parents and those coaches. Just anything that you would give for somebody that's interested in doing that.
Yeah. I think the most concise way to word it would be, don't force yourself. If you find yourself asking, how am I going to go about doing this? You're not in the right place. You should be so on fire to just get in and go that you follow that ready, fire, aim kind of principle. And so if you find yourself trying to, you know, either work up like, okay, I got to go in and I got to do this. And like, what if that doesn't work? Like, if you find yourself like too caught up in trying to do it, you're not aiming either at the right thing or your mindset's not in the right place. Like, it should truly be so much a part of your passion that like, it just happens almost organically. Now that sounds like kind of esoteric, but like, I go to the cheer gym and I'm there. I'm not kidding. Like, I'll be there for 6 or 7 hours at a time. And like, it just like, it's like I walked in the door like a minute ago. Like, I still have that. Like, I can't get enough. Like, I literally, like, I went there this morning. There was nobody there. I went into our cheer gym. The lights were off. We have a 70,000 square foot building. I mean, it's massive. And I went in and the only light pouring in was from the windows in the front pouring onto the mat. And it was dead silent. And the kids are all out because of the COVID stuff. And I just sat there by myself and stretched with nothing but the light from the parking lot on me. And like I could have sat there all day. Like, I never want to leave. I never want to leave that mat. And I find to be there, whether internally fulfilling something or wanting to check on the kids or, you know, in a place of, you know, coming up with content of like, what I always want to be there. And everything that I do, even though it may seem excessive because it's like one thing, but like, my whole life is this. It is like, I want to help these kids. Like, I want to change the sport. I want to give back so much that the only way I can is if I never step out. Because if I step out, that's time away that I'm not creating or I'm not giving. And so when I say like, you shouldn't have to think about it, like you have to get to that level. Maybe not as extreme as I am, because I'm not married and I live by myself. I have an awesome cat like John's, so my responsibilities here are less, but the passion either way, like it can't turn off. So if you can find a sport that you really can get, into, maybe not at this level, but to a comparable level, that will guide you a whole lot more and will help you a whole lot more, because you won't be dreading like the extra hours or the extra meetings or the research to make them better. You'll just want to do it because it just burns inside of you to do it. So if you can't find that in whatever activity you're looking to get into, keep searching. Like, it's okay to say no. Like, maybe you think like, oh, cricket would be awesome. I think cricket's awesome. But if I went to cricket matches and things, like, I wouldn't get into it as much as I love cheer. I would like it, but I would be a piss poor cricket doctor and I would be a great cheer doctor. So just be passionate, like find the fire. And if you can find it, like, just get ready for the ride.
Right. I think there was like, 20% or probably 80% if I flip it, that were crying because they don't have that same inherent drive. But that's okay, because there's books like Mastery by Robert Greene, and there's Tom Bilyeu, and there's Cal Newport, and these are the guys that kind of help you figure out how to do that. So those people should be associating themselves with some other information.
For sure. Those guys are, and like, if you are going to separate yourself, like, use that time to read books like that or listen to audiobooks that do get you back into it. Like, if I step away, it's only because like I need to do something that's going to make it better when I get back in. Right. So absolutely. Yeah, for sure.
Awesome, man. Well, I really appreciate your time. I know everybody who listened got something out of that. Rewind. There's a bunch of good stuff in there. Absolutely, man. No, I really appreciate it. If you haven't checked out Hit Zero, the ebooks, the nutrition, the TheCheerDoc stuff on YouTube or Instagram, you're missing out on a wealth of information. Again, Travis, buddy, love you, man. Thanks for being on, bro.
Love you guys. Thanks for having me.
Great talking.
See y'all next time on the Anatomy of Therapy. Peace.